Jenny McQueen, Plant-Based Treaty. We don't want Snackgate. Thanks for joining us. You have 5 minutes.
Thank you. Yes, my name's Jenny McQueen. I've been vegan for over 30 years, which is absolutely no impediment to my working for over a dozen years in the Ontario government as a statistical analyst. I'd like to read some experts' witness statements from 2 different doctors. The first is Julie Chan, who's a doctor of naturopathic medicine. So we strongly advocate for the adoption of plant-based milks, such as soy or pea protein milk, fortified with calcium as a suitable alternative to homogenized milk for children. It's absolutely essential to evaluate the health risks of foods beyond just protein content to ensure that patients adopt a balanced diet that provides long-term health benefits. So when I say patients, I mean seniors and children in this case, obviously. Cancer risks are exponentially higher in countries that consume the most meat and dairy. We urge policymakers to take immediate action to overhaul the current food system and promote a more plant-based system that prioritizes human health and the environment. We strongly endorse the Plant-Based Treaty and call upon governments, the Toronto City Council, to take bold action to make this vision a reality. So the next section was prepared with the help of Dr Zahra Kassam, who's a radiation oncologist in Toronto. She has an interesting point about older people. Perhaps they don't like plant-based food, but they can still have the majority of the menu plant-based and use greener by default or other nudge methods, given the benefits not only to the environment, but plant-based diets reduce risk of most chronic diseases and are included in the management of the multiple chronic diseases that our elders unfortunately now have, including diabetes, heart disease, hypertension, renal disease, etc. So it actually becomes a therapeutic dietary intervention to have plant-based food which will improve their outcomes and longevity. The Academy of Nutrition and Dietetics, in their position statement on vegetarian diets, read vegan, say that commercial, full-fat, fortified soy milk or pasteurized cow milk can be used as a primary beverage starting at age 1 year or older for a child who is growing normally and eating a variety of foods. In addition, the CDC says that cow's milk should not be given before 12 months of age, and milk alternatives also should not be given before 12 months. So we are being realistic, and we do know the expert opinion when we're advocating for plant-based products. In addition, the American Heart Association says from 12 to 24 months, unsweetened and fortified soy milk is an option for children who are allergic to dairy milk or who are lactose intolerant or whose families abstain from animal products. The key advantages to full-fat fortified soy beverage compared to whole cow's milk include much higher iron content, a nutrient of concern for children of this age, higher magnesium content, higher potassium, higher selenium, significantly higher folate, higher thiamine, niacin, vitamin E, and much lower saturated fat content. Children who are lactose intolerant but who consume dairy may be subjected to abdominal pain, diarrhea, and fatigue, and other negative impacts. Given the differing rates of lactose intolerance across different ethnic backgrounds, with higher rates seen in Indigenous and Black Canadians and other people of color, the heavy promotion of dairy can actually be viewed as inherent racism. To finish, I urge you to endorse the Plant-Based Treaty, not just for environmental reasons, but also for reducing demand for animals needlessly bred and trapped in the animal agriculture system. Thank you.